we're very blessed to have some of his knowledge today. He's going to bring us up to speed on AB 54, where we're at, and take it from there. So thanks, Gary.
I'd like to thank the library for hosting this today, and Jay for all his work in putting this great event together. I'm the president of Wisconsin NORML and the communications director of Is My Medicine Legal Yet? And I became interested in this issue by an accident at birth, my own. I was born with something called Noonan syndrome, which has left me with a lifetime of ill health. As a young child, I found myself rapidly going blind from glaucoma. I used to pray. I was raised strict Roman Catholic. I prayed at night I wouldn't go blind. I had frequent respiratory issues. You know, I got hit in the face at the ball at recess while other people were catching it. It was a pretty bleak childhood, and as a high school senior, I began to read in the paper that there had been some studies in California at UCLA about glaucoma and marijuana, that marijuana could reduce the pressure. But at that time, there weren't many good glaucoma medications, so I ended up trying it. And one of the times I tried it, I went to see my eye doctor in Milwaukee. I lived in Waukesha, and about an hour after smoking some cannabis, he found my eye pressures to be normal, 12 in each eye, rather than the 20s and 30s and 40s that he had been accustomed to seeing as he monitored my condition as a young child. So I made the connection that day that marijuana could save my eyesight. That was 37 years ago, this October 3rd. Since then, I've been using marijuana not only for glaucoma, but other conditions as I've aged. I've developed some myofascial regional pain syndrome from surgical scars from my heart surgery at age 14. I've got degenerative disc disease. In 1997, I had open heart surgery again, but I was left with an infection that nearly killed me. And marijuana helped nurse me back to health and get me through a long recovery. Before I had that surgery, something else happened in 1997 too. On February 27, 1997, that day I was a part-time resident of California at the time, and I went to the San Francisco Cannabis Buyers Club, of which this shirt is from, and I was allowed to become a member of that club for my glaucoma. That was 13 years ago today. For the first time in my life, I was able to go into a medical marijuana dispensary and buy my medicine. I didn't have the fear that I was going to get ripped off or I was going to get arrested or any shame that I was doing anything illegal. It was great, you know, but that was 13 years ago, you know. How many people here remember what they were doing 13 years ago? It's been way too long. There was one state back then, California. Now there's 14. We need to make Wisconsin the 15th. The Jackie Rickard Medical Marijuana Act would do that. AB 554, Senate Bill 368. One of the important things about this bill is the medical conditions it covers and how this can benefit Wisconsinites of all ages. One of the major positions in the bill is conditions is post-traumatic stress disorder. This is something that people from all walks of life suffer from. But lately we've been hearing a lot about it from returning veterans from Iraq and Afghanistan. Under the provisions of the Jackie Rickard Medical Marijuana Act, patients whose doctors certify they have post-traumatic stress disorder as well as a number of other illnesses could obtain medical cannabis. Some of the other illnesses covered by the bill include cancer, glaucoma, HIV/AIDS, Crohn's disease, hepatitis C. One of the conditions is Alzheimer's. My late father had senile dementia and Alzheimer's like condition for the last 16 years of his life. And he had to be medicated with antipsychotic drugs because of behavioral issues. Those drugs caused him to have tremors. So they gave him something else for the tremors, which didn't completely fix the tremors. My father hated taking those medications. It was a struggle for my mother and my sister every day. If we could have given him a brownie, a muffin with some cannabis in it, he loved to eat. If he could have had that for breakfast, his last 16 years would have been a lot better. He probably would have got back some cognitive function. Me and my father, who never got along that well he was, before he had this illness, we might have had some time together. And Alzheimer's is stealing a lot of time from people around Wisconsin. It's an illness that's coming. Cannabis could help it. This bill has something for everybody who has an illness, a serious illness. It also covers illnesses like multiple sclerosis and epilepsy and seizure disorders and spasticity. It's a very good bill. It basically was the state-of-the-art bill when it was written earlier this year, and I was able to have a lot of input in assembling this bill. It also includes all the language in Michigan's bill, which was passed in November of 2008. And as I was talking about going to a dispensary, it includes Rhode Island's dispensary language. They recently held hearings in Rhode Island to determine how their first 3 dispensaries are going to be run. This is model language, and Wisconsin needs dispensaries. And this is something that could really benefit our state. There's a lot of people here, patients and supporters with unique skills, and dispensaries could not only bring a lot of benefit to state patients and get them the medicine they need, not just marijuana to smoke, but also things like tinctures and salves and capsules and lozenges and different ways to get it in you. It's not about smoking marijuana, and that's why this bill would be so important. It would take having to get medical cannabis off the street in whatever form you can get, to having choices, to be able to get some cannabis and vaporize it, to put some salve on if you have a contusion, to take a capsule. Would free us from the drug market that only feeds the cartels, and we would get our medicine from people who grew it with love and integrity and honesty, and made sure there was no mold and pesticides and anything that could hurt us. We get it from people we knew, not the cartel, and we know it wasn't moldy or covered with pesticides or anything like that. So the dispensary portion of this bill is very important. As Jay said, I've been working on this issue a long time.